Welcome to this Cosmo educational session. Today, we will explore key insights from the article titled, A Qualitative Meta-Analytic Review of the Therapist Responsiveness Literature. Guidelines for Practice and Training, by Wu and Levitt, published in the Journal of Contemporary Psychotherapy in 2020. The authors explain that many researchers have stressed the importance of therapist responsiveness in psychotherapy. This concept refers to the ability of therapists to adapt their relational and intervention strategies to the individual needs of their clients. Therapist responsiveness is crucial in fostering effective therapeutic relationships and achieving positive treatment outcomes. The literature on therapist responsiveness aims to provide a clearer understanding of how therapists can fine-tune their approaches to meet the specific requirements of each client, ultimately enhancing the therapeutic process. The article highlights that therapist responsiveness involves adjusting interventions based on the client's emotional state, cultural background, and specific psychological needs. This adaptability is essential because rigid adherence to therapeutic protocols can hinder the therapeutic process and fail to address the unique challenges each client presents. The essence of therapist responsiveness lies in its dynamic nature, requiring therapists to continuously assess and respond to the evolving needs of their clients within the therapeutic context. Therapist responsiveness is not a new concept but has evolved over time. Early discussions, such as those by Coet and Seitz, introduced the idea of optimal frustration, where therapists balance challenging clients and providing support to foster healthy ego development. This concept was later refined to optimal responsiveness, emphasizing the need to tailor therapeutic responses to the developmental and relational needs of clients. Stiles et al. Further conceptualized therapist responsiveness by distinguishing between responsiveness to client features, such as age, gender, and diagnosis, and responsiveness through specific therapist actions, such as interventions and relational behaviors. This two-part formulation has provided a foundation for understanding how therapists can effectively adapt their approaches to meet the diverse needs of their clients. The review by the authors identified three main clusters of therapist responsiveness: responsiveness within relational dynamics, within interventions, and to client characteristics. These clusters were further divided into 8 themes and 21 subthemes. The first cluster, responsiveness within relational dynamics, includes themes like timing and attunement, relational needs, self-disclosure, and accepting responsibility for ruptures. For example, therapists are advised to attune to client distress, adjusting the pace and intensity of therapy according to the client's emotional tolerance. This involves noticing clients' emotional states and challenging them slightly while empowering them to control the emotional pace of therapy. The timing and attunement theme emphasizes the therapist's role in being perceptive and responsive to the client's immediate needs, ensuring that interventions are neither too overwhelming nor too passive. Another critical theme in this cluster is addressing relational needs. Therapists are encouraged to respond to underlying relational needs, especially when there is tension, and to discuss transferential and counter-transferential patterns. Effective self-disclosure by therapists can invite vulnerability from clients and heighten self-awareness. For instance, sharing relevant personal experiences judiciously can help clients feel understood and less isolated in their struggles. Additionally, therapists should accept responsibility for their role in ruptures within the therapeutic relationship, inviting client feedback to foster a collaborative and corrective emotional experience. This involves acknowledging mistakes and making reparative efforts, which can strengthen the therapeutic alliance and model healthy relational behavior for clients. The second cluster, responsiveness within interventions, covers how therapists adapt their interventions based on clients' needs. One of the themes here is transformation through exploration. Therapists are encouraged to prioritize conveying understanding to validate client experiences, maintain curiosity about clients through regular check-ins, and respond to in-session emotions. This approach promotes a deeper exploration of clients' concerns and validates their experiences, fostering a stronger therapeutic alliance. The emphasis on understanding and validation helps create a safe space for clients to express and process their emotions. Another theme within this cluster is insight and interpretation interventions. Therapists are advised to observe client signals indicating readiness for insight and interpretations and to attend to clients' degree of emotional contact to facilitate emotional insight. Challenging clients and structured exercises also play a role here. Therapists should challenge clients when growth is obstructed and use structured exercises to strengthen clients' agency, particularly when clients show low attributions of control or high negative self-attributions. For example, using cognitive behavioral techniques to challenge distorted thinking patterns or employing role-play scenarios to practice new behaviors can empower clients and enhance their sense of control. The third cluster, responsiveness to clients' characteristics, focuses on how therapists adjust their interventions to better meet the needs of clients with specific diagnoses and cultural backgrounds. For clients with post-traumatic stress disorder, PTSD, therapists are advised to use a stage model that begins with exploring clients' potential concerns about burdening their therapists, then gradually encouraging emotional connection with traumatic memories to resolve symptoms. This phased approach helps clients build trust and safety before delving into traumatic material, ensuring that they are emotionally prepared for this challenging work. For clients with depression, therapists should facilitate increased engagement, validation, and agency, being patient and avoiding taking control when clients are unmotivated and pessimistic. Techniques such as behavioral activation, which involves scheduling pleasurable and meaningful activities, can help combat the inertia often associated with depression. Additionally, providing consistent validation and reinforcing small achievements can help clients regain a sense of agency and hope. When working with clients who present with personality disorders, therapists should focus on empathic understanding and validation before gradually proceeding to interpretations. This approach is particularly beneficial for clients who engage in self-harm, as it helps explore the underlying painful emotions related to their behavior. Therapists can employ dialectical behavior therapy, DBT, techniques to help clients develop healthier coping mechanisms and enhance emotional regulation. Cultural responsiveness involves inviting discussions about cultural factors and misunderstandings, adapting communication styles to match clients' cultural backgrounds, and exploring experiences of oppression and discrimination as well as pride in marginalized identities. Therapists should be aware of their own cultural biases and strive to create an inclusive and respectful therapeutic environment. Engaging in cultural competence training and seeking supervision or consultation when working with clients from diverse backgrounds can enhance therapists' ability to provide culturally responsive care. In conclusion, the authors provide a comprehensive overview of the therapist responsiveness literature and its implications for psychotherapy. Their work highlights the central role of relational dynamics in understanding and treating psychological issues and calls for continued research to deepen our understanding of these processes. By focusing on therapist responsiveness, clinicians can enhance their ability to help clients achieve meaningful and lasting change. The emphasis on adaptability, relational attunement, and cultural competence underscores the multifaceted nature of effective therapy and the importance of personalized, client-centered care. Looking forward, the authors identify several key areas for future research in the field of psychotherapy. They emphasize the need for more empirical studies to examine the specific mechanisms through which relational dynamics influence therapeutic outcomes. This includes investigating how different aspects of the therapeutic relationship contribute to change and how therapists can best intervene to modify maladaptive relational patterns. By exploring these mechanisms, researchers can develop more precise guidelines for therapist responsiveness, thereby improving clinical practice. Furthermore, they call for research that explores the impact of cultural, social, and contextual factors on the therapeutic process. Understanding how these factors interact with relational dynamics can help therapists to tailor their interventions more effectively to the unique needs of each client. This research is particularly important in our increasingly diverse society, where cultural competence is essential for effective therapy. In conclusion, the authors provide a comprehensive overview of the therapist responsiveness literature and its implications for psychotherapy. Their work highlights the central role of relational dynamics in understanding and treating psychological issues and calls for continued research to deepen our understanding of these processes. By focusing on therapist responsiveness, clinicians can enhance their ability to help clients achieve meaningful and lasting change. Thank you for joining us in this session.